Hey everybody, it's the day after Thanksgiving. I'm taking the day off. I haven't shaved, but I wanted to talk about some problems that people are having with getting started on buprenorphine when they're using fentanyl. And so there's a couple of the videos that I have that talking about microdosing on buprenorphine if you're coming off of methadone or fentanyl. Another one, how to get off of fentanyl and onto buprenorphine. But those protocols that I talk about, known as microdosing or the Bernese method, don't work for everybody because everybody's brain is different and some people have to take it a little more slowly. And so I've had a number of patients who have had to, instead of doubling the dose every 48 hours, maybe they'll go up by 50% every 48 hours or 50% every 72 hours, every 3 days. So rather than like an 11 or 12 day ramp, it's more like a 24 or 21 day ramp or something like that. Usually it seems like the problem is when you're going from like 1 milligram up to 2 or 2 milligram up to 4, like right in that transition is when that faster protocol of doubling the dose every 48 hours. So you usually start with a quarter of a 2 milligram tablet, that's half a milligram, and then you take that for 2 days, and then you increase it to a half of a pill, which is 1 milligram, and then 2 days later you go up to 2 milligrams. 2 days later you go up to 4 milligrams. So it's totally fine to slow it down and to go every 3 days to increase it or increase by a slower amount, especially as you're going from 1 to 2. Maybe instead of taking the 2 milligrams as a single dose, also you can divide it up into multiple doses. So as you go from half of a pill to 1 pill, to take that a half a pill twice a day, and then as you go up, maybe instead of going from 2 milligrams to 4 milligrams after 3 days, go from 2 milligrams to 3 milligrams. So you take half a pill 3 times a day, spread it out. So you're taking a lower dose at any one time, and then you're giving your brain a little longer to get used to that buprenorphine as you ramp up. That's totally fine. I am going to remind all my viewers that a relapse is not anything to panic about. I have been trying to communicate this concept to my patients lately, and that is that a relapse is not an opportunity to judge your worth as a human, okay? It is an opportunity to measure where you are in recovery, however. So saying that another way, when you relapse, don't get stuck in this hopeless, worthless, negative internal dialogue. I mean, relapses happen. It's a chronic relapsing disease, and sometimes stress level exceeds your capacity to deal with it, or that you lose your kind of recovery program, and you stop going to meetings or stop talking to your sponsor, or whatever the reason is, people relapse. Okay. And the mistake that people make is to just keep driving right off the cliff, and instead of pumping the brakes and after a day or two be like, okay, this is not going to work out, and so I need to get back. Or if it's been longer than that, whatever, is to ask for help, and to instead of judging yourself harshly, is to say to yourself, I'm not where I need to be in recovery right now. I don't have enough recovery skills right now, stress management skills right now. That's the reason I relapsed, because I'm not doing what I should be doing or what is necessary for this situation as far as recovery work, instead of just tearing yourself apart. Okay, so that doesn't help. People who have a chemical dependency problem are valuable people, and they have a lot to contribute to the people around them and the world around them. They're mothers and fathers and brothers and sisters and sons and daughters and workers and creative people and all kinds of wonderful things, but they do happen to have a problem called chemical dependency, where they feel like they're emotionally dependent on a chemical, where they feel like they can't function, they can't deal with things, whatever, that they feel compelled that they have to use a substance in order to deal with what's going on. And it's a shitty thing. It's a curse, and it unfortunately destroys a lot of people, and it kills a lot of people. I just had a long-term patient of mine who I knew he was going through some struggles, but I didn't realize how much struggles he was going through, and he passed away recently. And that was kind of a shot to me, a real shot to me, what did I miss here? What could I have done? How could I have, intervened, differently? So it's a tragedy, and I wish that I had the right words, or that he felt comfortable talking to me about what his struggles were, those sorts of things. So I'm still trying to refine my skill set as a physician, and trying to get better every day. And sometimes relapses happen, and sometimes relapses end in tragedy. So we're trying to, of course, avoid that. But the reality is relapses do occur. It's just a common problem. It's chemical dependency is a chronic disease that tends to result in relapses. Hopefully those relapses are short and they have a long distance between them, but regardless, it's going to happen. And people, fentanyl is widely available, it's very inexpensive, and so people frequently are on fentanyl, and then they have a hard time getting back onto buprenorphine, otherwise known as suboxone. Do it generally by microdosing if you don't have another alternative. Another alternative is to get off the fentanyl for 5 days or something like that, and use Vicodin or oxycodone or morphine, or if you're certain that it's actually heroin. Frequently heroin is actually fentanyl. So anyway, that's my message, and sorry, people are calling me. Hopefully this holiday season you guys are able to get through, keep a positive attitude, don't tear yourself apart, get back in the saddle, microdose, use your brain as a guide. You don't have to necessarily follow the 48-hour doubling protocol. That's one way to do it, but some people, that's just too fast. All right, happy holidays.